And so, good afternoon, everyone. Thank you so much for joining us today for Good Medication Management. My name is Amy. I use she, her, and I am the Caregiver Wellness Coordinator at the Scarborough Center for Healthy Communities. I'm very happy today to be bringing you a great session on how to help understand what medication management is and how we can implement good medication management. I'm really happy today that I have an expert voice coming here to come to us today to be able to bring her insights, working in her field as a nurse on the acquired brain injury team at the Scarborough Center for Healthy Communities. So with that, I'm very happy to hand things over to you.
Thank you, Amy. So hi, everyone. My name is Shagini, Nithianadarajah. I am a registered nurse. Oh, of course, I have to get a call just right now. I am a registered nurse with the ABI outreach team. Today, we'll be focusing a little bit on medication management. We'll look into some stuff about polypharmacy. We'll look into deep prescribing. We're going to look into providing you with some resources to help you manage your medication, help you reach out to the right members to get supports in regards to your medication, and where to look for information on medications. But before we get started, it would be helpful for me to get to know who's here and a little bit about the type of medications, or even like just a little bit about what kind of medication regime you kind of have going. And so I'm going to we have a couple polls and a few poll questions. How many medications are you taking? Ballpark range. You guys can kind of throw out numbers for me just so I can see like how many medications are each one of you maybe taking in a day.
I'm going to say upwards of a dozen or so medications.
Okay, so 12 plus. Okay. Any other kind of numbers out there?
But I know he takes at least 4.
Okay. So that happens quite often as well, where people are not able to actually exactly say what medications they're taking because they don't know what they're taking. So it's just for me to kind of get an idea of what kind of crowd I have here. The other question I wanted to know is, do you know why they're taking each of their medications? So just kind of going back into what Amy was just mentioning right there. Do they know what medications they're taking and why they're taking each of those medications? Or do you find that most of the time they don't really know? Or you might not really know, and you're just kind of taking it because that's what you're told to take.
You know, my mom in the early stages of dementia, she has a memory pill and a high blood pressure pill. And the third one, she doesn't know what it is. And from day to day, she doesn't know if she's taking the medications or not. So that in itself is something that, you know, I need to know. So I know what medications she's taking. I have a list of the medications my sister is taking, and I have put full I'm feeling good about the doctors managing her medications in the long-term care. So
okay. And you actually answered my second question. Do you take more than one medication per diagnosis? So with some of those diagnoses that you've mentioned, there's a likelihood that there's multiple medications per diagnosis to take to kind of manage symptoms.
Yes.
So that's quite common, and that's quite so I'm assuming quite a few people who as well will have very similar medication regimes where they're taking multiple medications per symptom and per diagnosis. And just out of curiosity, are you comfortable speaking with your healthcare provider about medications and side effects experienced by your sister, your mom, by any family member, yourself?
Yes. And because I go on the internet and look up things, go to my doctor and say, what about this? What about this? What about that? So because I have a list of my sister's medications and I want to know what they do or what they're for, I've looked them up on the internet. And so, what are these things for? And then if there are questions that I have about it that I find on the internet about these medications, then I can ask the healthcare providers at long-term care when we have our plan of meeting, our review plan, or even if I just want to email them. I mean, the place where my sister is, they're so good about communication. I could call them up today after this webinar and say, listen, I learned about this. Can we talk about it, or can you tell me about it? So they're pretty good that way.
Great. Okay. So So that's huge. So it's actually really good that you have a very good you have good communication with the healthcare providers that are providing these medications, because it's important to know side effects to look out for. And we're going to go into that a little bit more later on. And the last thing I wanted to kind of have an idea about is any over-the-counter medications that anyone is taking that you haven't actually disclosed to your doctor. Because lately, with a lot of naturopathic medication options, there are the ability of taking other medications that may not have been disclosed, something that you may have heard from word of mouth. So just out of curiosity, any other over-the-counter medications that you've never really mentioned to the healthcare provider that either even yourself may be taking? Yeah.
I think I've disclosed all of them to my primary healthcare provider, but I feel like when I talk to other healthcare providers, I don't always mention them because they don't ask or they don't feel relevant.
That's fair. That's fair.
Yeah.
Yeah.
You know what? I don't know that I have either, Amy, because I think of it as an automatic thing. You take your multivitamin, you take your vitamin D, you take whatever, those over the counter kind of things. Yeah. And I just never think about telling my healthcare providers that information.
Yeah, exactly. So a lot of people actually don't share that information as well. And so this is like going to be a good way for us to kind of go over, I'm going to be providing some resources so we can kind of go over how important that actually is to share, because some medications actually react with the over-the-counter products that we might be taking, and we may not even know it. So let me actually go into the next slide here. So per medication. So typically what most people do know is the name of the medication, and that's as far as they really know. But when it comes to medications, it's actually quite important to know more than just the name of medication. So the most important things to know about medications is the name of the medication that you're actually taking, how it is to be taken. So the dose is how much of the medication you should be taking. The route is it by mouth, in the eye? Does it go by in your ear or in your skin? Because a lot of times some people don't know the route and they're taking it in, they might be taking it in a completely different route altogether, and that's not going to be providing the most beneficial effect of that medication. And we should know when and how often you should be taking that medication. So when you're being prescribed a medication, you should be aware of when you should take that medication, like the most ideal time. Some medications are more ideal to be taken.
And you're getting a bit.
Anyway, sorry. So back to what I was saying. And how often we should be taking our medication is important, because sometimes we might be taking a medication less than we need to, or more often. And it's good to know so that we're getting the right amount of dose. The reason for the use of each medication is important to know. Some medications have multiple uses. So an example of that would be Tylenol. Tylenol, it can be used for pain, can be used for headaches, can be used for fevers. And so they can be used for multiple different things. So it's good to know what the medication you're taking and the use for your specific diagnosis. So that's one important fact to know. The start date of the medication, in addition to the stop date of the medication, and how long you're expected to take the medication. Why I say this is sometimes you may be put on a prescription medication for a while, and you may be taking it for a couple of years now, but once you start a new medication, it's expected, or you're being told to stop one of your previous medications to prevent a reaction. So a lot of people don't actually know, or a lot of people continue to take medications because they've been taking it for so many years, not realizing that there might be a stop date to a medication based off of a new drug that they've been providing you. So it's good to know when to start and stop taking a medication, and how long your doctor would like for you to continue to take a medication, and how long they want you to actually use that medication for, to see if there's any improvement in side effects or symptoms. It's good to know who's prescribing your medication, because multiple people or multiple specialists and doctors are involved in your care. So it's good to know if you have a specific specialist that's giving that medication, so you can kind of know why you're taking that medication as well. Additional information that's really helpful to know as well is if there's any changes in doses. So sometimes with medications, they may do a slight increase with symptoms. So they're called PRN medication, so the as needed medications. Sometimes they'll say you take them when you need it. Sometimes some of those medications might be, they might increase the dose depending on how you're feeling, or they might say for the first 2 weeks, you would take a certain amount, and then you will increase by 2 units for the next. And so like, these are good things to know if there has to be any changes and to keep track of, so that you know if you started at a minimal dose initially and how your doses have increased. You should also know what side effects to watch out for, as these are going to be very helpful in knowing when to stop taking a medication, or very good information to share with your healthcare team and providers, so that you are not overtaking a medication, or you're not getting an ill side effect to a medication that you have been prescribed. And also you should know what are the helpful, like, so what are the symptoms to look out for that indicate that they're working for you, that this medication is working for you. So sometimes your doctors will be able to provide what it would be if something goes wrong, so a side effect to a medication, in addition to the helpful symptoms to look out for that makes it for you to know that the medication is actually working. Also, in addition to that, with some medications such as blood pressure or blood sugar medications, it's good to know if there's any at-home monitoring that you need to do and what are the results you're looking for. So sometimes you may not, you may be taking a blood sugar medication, but checking your blood sugar, if you're checking your blood sugar on a daily basis and it's within normal limits, you may not necessarily need to be taking a medication. So it's good to consult with your healthcare provider with that, especially if you know what kind of results you're looking for. So those are quick questions to ask your healthcare providers about each medication. So this is actually a medication history and experience form. Amy has been kind enough to provide one to each and every one of you present in the presentation. So this is actually a really good way for you to kind of keep tabs of medications that are being taken by your loved ones, by yourself, or anyone. And so this is a good way for you to kind of have all your information on one document, and you can take this to your healthcare provider. You can take this to your pharmacy. If you have questions, this is a good thing to fill out for you to know. And so this actually hits all the topics that I've mentioned. That's good to kind of know about each medication you're taking. So the name of the person who is the name of the person who's taking the medications, the emergency contact information, those are all great to know. Pharmacy details is great to know as well. Any drug reactions that they may have, so any sort of allergies, any intolerances are good to know as well. And then followed by your medication list. So your current medication list will give you the medication name, the route, the dose, everything that you need, the reason for the medication, the start date, the stop date, who it's prescribed by, and all the additional information I had mentioned. So you can write down side effects, the helpful symptoms that you're looking for, and any type of monitoring that's expected, in addition to the results you are looking for before you follow up with your healthcare providers. So this is a really good way of tracking all your information, all your health or medication information for appointments. And also it's just a good kind of a document to have with the history of medications. I don't have the lower portion, but at the lower portion as well on that tracker, you'll see there is a vaccination list. So it gives you a section where you can write where you had last been vaccinated for certain vaccines. So this is kind of like a document that you can use so that you can kind of keep track. And also it's actually a fillable document as well. So you can, if you'd like to kind of type it in, you can kind of go back and type in anything and add and take out any information as needed. So keep tabs of all your medications, and also ask your healthcare providers, your pharmacy, even your healthcare team about questions about each medication that your family members or yourself are taking. So a little bit about medication. So medications are wonderful. Like they do have a great purpose to it, and some of them is used to treat symptoms. So they do help treat symptoms. Medications prevent conditions from getting worse. So antibiotics would be given to someone who has an infection. Antihistamines are given to someone who has an allergy, so it prevents something from getting worse. Medications also reduce development of further medical conditions. So they can be used to treat different, like medications are given to people who may have had a history of strokes. They're given to people who have rheumatoid arthritis to prevent symptoms from getting worse. Medications are also, there's the other thing to keep in mind with medications is that they're used for many different symptoms. So as I had mentioned earlier, Tylenol is a medication that is used for very different symptoms. So that comes with its own benefits. So like there can be multi-purposes for medications. And they also help reduce the risk of any further medical conditions or any new conditions. So it can help with someone who may have had a heart attack or a stroke. Taking a medication such as statin might prevent them from having further heart blockages. So medications have a very positive outlook, and they do help and have quite a bit of benefits to them. However, in polypharmacy actually is a term that we use for people who are taking a routine dose of 5 or more medication. There is a bit of a backside to medication in the sense that when you take so many medications, it can be confusing. There might be side effects that you are not aware of that you're experiencing now. There can definitely be confusion with taking so many medications. And so polypharmacy is the use of multiple medications at the same time for medical conditions. And it's, like I had mentioned earlier, it's 5 or more medications that you're taking on a routine basis. Polypharmacy is the use of more medications than there are needs, and it actually outweighs the benefit of the medication. So when you're taking so many medications that it may not necessarily be beneficial. That's what polypharmacy goes a little bit into. So this particular concern is actually more common in older adults than it is in younger, but it is a trend that is going on right now with older adults. So that's just kind of a little bit about what polypharmacy is. But what is the problem with polypharmacy is that there is an increased risk of drug interaction and side effects. And when you take multiple medications, they can interact with one another and create new symptoms. And this is quite common with older adults because of the fact that they may be more frail. The drug might be responding a little differently than how it may have been before. And also, unfortunately, there's a lot of research done on medications, but they're not specifically directed towards older adults themselves. And so this may be one of the reasons why the reaction or symptoms that they're experiencing may not necessarily be something that they have a lot of research on. So there's also trouble taking medications as directed. Again, when there's more than 5 medications that they're taking, they may have a hard time recalling why they're taking medications. It might be hard to kind of keep track of which medications you take when and what the reasoning for each of these medications are and the side effects of each of these medications. So that was one of the other reasons why taking multiple medications can increase a risk. The body and mind are not moving as it used to or as it should. So with changes in medications, you may react different to each medication. And as the body changes and as you react to each medication, the reactions may be different and as to what it was when you actually started taking the medication. So with changes to the body, with changes to the mind, that is quite common. With age, there is falling risk and fracture risks that occur and hospital admissions that increase as a result of taking so many medications. So let's get into what happens to the body as we get older. So the brain becomes a little bit more sensitive to the effects of the drug, which may not have been the reason when you actually started taking the medications, but this could change. And the other thing is it can cause more of a sedation and memory effect. And so maybe the client is taking a medication and they have their body, as they're getting older, their body is a little bit more sensitive to the medication. And now something that may have not made them drowsy before is now starting to make them more drowsy and sedative, which makes it harder for them to kind of focus. So that's one of the things that can happen to an older adult as they age. Medication can also stay in the body longer because of less muscle mass and more body fat. So the way the body is reacting to the medications is different with the changes to the human anatomy. So medications require really good kidney and liver functioning. And if there are even, when we're younger, we have a better, like those are processing a lot better. So if a medication needs the kidneys to clear out the body, the medication from the body, and the kidneys are not functioning as it used to, the medication could end up staying in the body longer and leading to a higher drug level of that medication. So there might also be something where the medication dose that they're currently getting may not necessarily work the best because their kidneys are not filtering out that medication as it should. The body also contains less water and medication, and medications can be more concentrated in the body when there's less water in the body. So it's not filtering as well. Again, has to do with the kidneys and has to do with changes to the body as we get older. And not all symptoms are because of age. Some of these are because of new side effects that come up as a result of changes to medication. So as you can see, some medications may have specific side effects initially, and they may increase, there might be new changes or new side effects to the medication. Antipsychotics are one of them, where the reaction to or the side effects of antipsychotics may differ based off of certain diagnoses. And so it might not necessarily be just with age. And so the other thing is, so like new symptoms could also be due to body changes and responses to the medication. So as we're getting older, the body is changing and the doses may not necessarily be accurate for the person. The body's changing constantly, and because the body's changing, a medication that may have worked before may not work anymore. So it's always good to kind of keep track of the medications that are being taken and the side effects and the helpful side effects, so that you are aware if a medication is no longer working for the person. So these are a few kind of infomercial, like pamphlets for you to kind of take a look at, and they will provide you with side effects to look out for when something may be going wrong. So it gives you examples that you may recognize in yourself or the person you care for, and how that might flag, how you should be flagged when certain symptoms are being present, and you should be following up and getting medication assessments to address some of these symptoms should you notice that some of these symptoms do fall up. So some of the symptoms to keep an eye out for is sudden changes such as confusion, dizziness, drowsiness, hallucination, mood changes, dry mouth, blurred vision, difficulty swallowing, constipation, diarrhea, nausea, change in appetite, urinary symptoms. So that means either an increase or a decrease in urine, bleeding, bruising of the skin, changes to the skin, and swelling. So please be advised that these are some of the symptoms that you may experience. So it's always better to discuss any new symptoms or any changes with the healthcare provider, as some of these symptoms may be your norm. So it is good to kind of keep an eye out on changes in symptoms, knowing what side effects to look for, and also to just know when something is wrong. So when there is something wrong, you should reach out to get some medical assessment or speak with your healthcare provider to see if potentially it's some of the medications that you are taking. Medication can also react different with certain substances or herbal remedies. It's always better to consult with your healthcare provider before taking a medication. So for example, so some people may take iron supplements, and taking calcium there's some reactions. So it's always good to kind of speak with the healthcare provider before taking any over-the-counter supplements or herbal remedies, as they might interact with something on a thing that you do on a day-to-day basis. So that can also include same thing with cannabis, cigarette smoking, coffee, and any herbal remedies. It's good to kind of speak with your healthcare provider to make sure that there is no reaction that can potentially happen with the medications that you are diagnosed with, or medications that you're given to help with your diagnoses. So what can we do? So what are some of the steps that we can do to help get a better idea of the medications that we're taking, and further prevent any symptoms or further prevent any issues or polypharmacy from occurring? One is always doing a medication review. A lot of people don't know this, but pharmacies offer medication reviews. So you can actually take your medication to the pharmacy and they will review and go through your medication list with you. And they will also discuss some of the symptoms and side effects as well that you can experience for medications. So you can schedule an appointment with your pharmacist and go in to have your medication reviewed. You can speak with your healthcare provider about your medication. So that's speaking with your doctor, your nurse, or your healthcare team about the medications that you're currently taking. And you can have them reviewed based off of some of the symptoms. And this would be a great time to have like just a conversation about if you're experiencing new symptoms or experiencing changes, or if there's something that you can look out for, such as those helpful symptoms to look out for. This would be a great time to kind of go ahead and do that, so that you can know when your medications are actually working for you, or when maybe there is a need for a change in your medication. Deprescribing medication in a collaboration with your healthcare team. So deprescribing is actually for someone who is taking more than 5 medications, sitting down with the healthcare team in addition to the client themselves, going through each medication to get a better idea of whether the medication is working or not working for them. You work in a team unit so that they are also aware of if there's new medications that need to be added or taken away, or if there's any reactions that might be happening as a result of 2 of the medications. So it's good to kind of do that in a collaboration. Learning about what each medication is being used for. And this is important. A lot of people are taking medications not knowing why they're taking a medication, not knowing the reasoning for the medication. And it's good to always know, because it gives you a better idea of what to look out for when you know what the medication why you're taking a certain medication, you know what to look out for. And so learning about each of your medications, why you're using it, how it's helping, if it's not helping, when to stop, when to take, will help you kind of get a better idea of how to get a better idea of whether you should continue to take a medication, whether you should really consult with your doctor to stop taking a medication. And the last thing is sharing symptoms and side effects experienced with your healthcare provider. It's very hard, especially when some of these symptoms seem very generic, like the dry mouth, or vomiting, or diarrhea, or just constipation. And not everyone wants to discuss with their doctors every symptom, but it does come with the benefits of sharing these symptoms and side effects with your healthcare provider, because it might actually just be a medication creating an issue, or an interaction of a medication creating an issue, instead of your actual medical condition. So when you have those open conversations and that open dialogue with a healthcare provider, they'll be able to kind of better lead you in the right direction and either deprescribe medications for you, or give you something that may help treat some of those symptoms as well. So who should you speak to? Well, as mentioned, pharmacy, your doctor, nurse practitioner, a nurse, family caregivers. Everyone works as a team, and it's very helpful to kind of work in a unit or in a collaboration to share this information. So those are some of the people that you should be speaking to, and you can be speaking to about these concerns, and they can, take you to the right places if needed. So places where you can get information about medication. So there are so many places, and we have access to Mr. Google, Dr. Google. We have access to books, pamphlets, flyers, healthcare team. There's websites, TVs, word of mouth from friends. There's so many information about medication everywhere. But the issue that we run into is not all medication information is reliable. So it's knowing what's reliable and what's not reliable. So I just have a list over on the side over there with people that you should or you can reach out to for information. So when you're looking for information, healthcare providers such as pharmacists, physicians, nurses, they're great resources to reach out to about specific medications. There are certain government websites and websites that end with .gov and .edu. These are great websites to use when looking for medication information because they are resources that have been researched, and they have their researched information that are accurate and have been looked into instead of kind of word of mouth. Medline Plus is one of those medications. There's also drug books that there's access to as well that you can look at to get at information. And Telehealth Ontario, they're able to provide information if you have questions about medication. So those are some of the places you can take a look at. Just make sure, it's very challenging to kind of find out what is reliable. So just make sure if you're looking into medications online or anything of that sort, see if the author of the organization has expertise training when you're looking at information, because like you're looking at healthcare professionals, medical institutions, government health agencies, those are places that have medical training or have information that is accurate and not just kind of opinionated. And information does change with new evidence. So keep in mind, information you read about and we're told about at one point may no longer be the same. So it's always good to keep up to date with the information that you're looking at. So if you may have looked at something 3 years ago, the information on that medication specifically may have changed. Like you can see right now, in addition, like with the COVID situation, information is constantly changing on such a rapid kind of scale that it's the same with medications. Medications get tested and changed, and there's different side effects and reactions that come up within the years. So when you do look at information, make sure you're looking at the most current and up-to-date information about the medication, and that the source that's providing that information is a reliable source. So that is pretty much all I have for today. Thank you so much for listening to this medication management presentation. If you have any questions, please feel free to go ahead and use this time to reach out, and you can ask any questions. Thank you.
And so thank you for that session. I will start